Welcome to Med 5. The goal of our channel is to simplify medical concepts and help you understand them like shelling peas. Today, we're decoding two lesser-known zoonotic orthopoxviruses, cowpox and camelpox. Try answering these cues before we begin. Where inside the cell do cowpox and camelpox viruses multiply? Which of these organisms is associated with cancer? Stay tuned. Cowpox and camelpox are orthopoxviruses, part of the Poxviridae family. They're large, brick-shaped enveloped viruses with linear double-stranded DNA genomes. They're among the biggest animal viruses known. Unlike most DNA viruses that use host enzymes in the host nucleus, orthopoxviruses replicate entirely in the cytoplasm using their own transcription machinery. Cowpox and camelpox are close relatives of monkeypox and smallpox, sharing structural and genetic features. Importantly, neither of these viruses, nor any member of the Orthopoxvirus genus, has been associated with cancer. Let's focus on the cowpox virus first. This microbe has a broad host range. Immune evasion proteins allow infection of rodents, cats, cattle, and humans. Transmission to people occurs mainly through direct contact with infected animals, especially cats and rodents. At-risk groups include farmers, veterinarians, and immunocompromised individuals. After an incubation of about a week, patients develop a localized lesion at the area of exposure that evolves from papule to vesicle, pustule, and scab over 3 to 6 weeks. Symptoms may include fever and lymphadenopathy. Cowpox usually resolves spontaneously in healthy individuals, though minor complications such as secondary bacterial infection can occur. In the immunocompromised, disease may be more severe and prolonged, with complications including disseminated lesions, pneumonia, and even sepsis, a life-threatening, body-wide inflammatory response to infection. Diagnosis relies on PCR of lesion swabs or tissue samples, with electron microscopy or viral culture as supportive methods. Treatment is supportive, including wound care, pain relief, and antibiotics if secondary bacterial infection develops. Antivirals like tecovirimat may be considered in severe cases. Prevention focuses on avoiding contact with infected animals. Smallpox vaccination provides cross-protection against cowpox. To learn more about cross-immunity within the Orthopoxvirus group, check out our video on variola and vaccinia. Next we have the camelpox virus. This bug primarily infects camels rather than humans, but we still study it for its similarity to variola, the smallpox virus, a microbe once deadly and now viewed as a possible bioterror weapon. Camelpox spreads through direct contact or contaminated materials, mainly affecting herds in parts of Africa, the Middle East, and Asia. In camels, the illness begins with fever and progresses to skin nodules, pustules, and scabs. Most cases resolve in a few weeks, though young or weak animals may suffer severe disease, including pneumonia or systemic infection. Human disease is exceedingly rare, typically presenting with mild fever and small pustular lesions. Human camelpox cases resolve without serious complications. Diagnosis relies on PCR or electron microscopy of lesion swabs, primarily performed in camels. Treatment in herds is supportive, with attention to preventing secondary infections. Outbreaks can devastate camel herds, hurting the livelihood of pastoral communities, but vaccines are available to help curb such outbreaks. In humans, diagnosis is rarely needed given the extremely low risk. Management is also supportive. No special vaccines are needed for camelpox prevention. General hygiene and limiting camel contact provide more than enough protection. Let's revisit our questions. Where inside the cell do cowpox and camelpox viruses multiply? Answer: the cytoplasm. Which of these organisms is associated with cancer? Answer: neither. No orthopoxvirus is linked to cancer. Got both right? Booyah! If this video helped you, help our channel grow by hitting like, share, and subscribe. Check out the comparison table from the link in the description. Thanks for watching. Keep learning with Med 5's mini medical guides.